Yes, I think I can quite easily follow up on Timor. I will briefly present the policy framework on HIV/AIDS in the EU and neighboring countries, which is basically a communication on the issue and the action plan that Timo has already referred to. As you may notice, both the communication and the action plan actually have a time period to it, 2009 to 2013, and I will get to this later. So the Commission communication sets out the main policy priorities on HIV/AIDS, and the main objectives are to reduce HIV infections, to improve access to prevention, treatment and care, and to improve the quality of life of people living with HIV/AIDS. The communication focuses on certain key issue areas, which are prevention, priority groups, priority regions, and increasing the knowledge base and dissemination of information. All of this should be done and is done with broad involvement of civil society and other stakeholders. Now, the other part of the policy framework is the action plan on HIV/AIDS, which includes 50 actions which are clustered around 6 main issue groups. The first one is political leadership, the second one prevention, priority groups, priority regions, improving the knowledge, and monitoring and evaluation. As Timo already indicated, political leadership is a crucial issue to keep HIV/AIDS high on the political agenda. The Commission is also committed to involve all stakeholders, particularly civil society, for instance, through the Civil Society Forum on HIV/AIDS, and the member states through the think tank. A key issue is also to tackle discrimination in relation to HIV status, and our Commissioner is very much committed to follow up on these commitments. And last but not least, development and implementation, monitoring and evaluation of national, regional, supranational HIV/AIDS policies. Prevention has 2 aims. First one, targeted prevention to the local realities, to the most at-risk groups, and to improve the exchange of information and best practice, and also to target HIV transmission and risk behavior through the strengthening of behavioral surveillance and the development of countermeasures, but also by analyzing trends and dynamics in risk behavior. The priority regions. These are essentially the East European EU member countries, East European countries in the European Neighborhood Policy, and the Russian Federation. I think this comes clearly out of the data that was shown by Timur, that these are the countries where we need to focus on. In terms of actions, the goal is to reach universal access to voluntary testing, treatment, and care, to introduce and implement effective harm reduction measures, prevention and integrated HIV, TB, and co-infection treatment, which is still a big challenge in many countries, and to promote cooperation between the EU and neighboring countries on HIV/AIDS. As for the priority groups, we have 3: men having sex with men, migrants and mobile populations, and injecting drug users. In terms of actions for men having sex with men, obviously the promotion of safer sex behavior, information on prevention and integrated sexual and reproductive health education, and the implementation of voluntary counseling and testing programs. For migrants and mobile population, the access issue to services and treatment, but also issues of discrimination in terms of HIV-associated travel and residence restrictions, and for injecting drug users, the implementation of harm reduction measures. Improving the knowledge, research, medicine, and surveillance. Of course, promoting research to find new prevention and treatment solutions. Medicine, and this particular refers to health professionals, improving capacities and knowledge of the medical staff and disseminate clinical best practice. And surveillance to complete and improve the surveillance mechanisms on all relevant aspects of HIV/AIDS and co-infections. Last but not least, monitoring and evaluation. The ECDC is working on monitoring the commitments done under the Dublin, Vilnius, and Bremen declarations. So we have regular monitoring here. And of course, also monitoring of the implementation of the action plan, which has also been done by ECDC, and currently we are working on an external evaluation of the action plan and the Commission communication. The communication and the action plan are jointly implemented through various Commission services. It's not only DG Sanco, but it's also Research, Development Cooperation, the External Action Service, and DG Enlargement. We're also working through the EU agencies, the ECDC, the Executive Agency, the European Monitoring Center for Drugs and Drug Addiction, and the Fundamental Rights Agency. Through the Civil Society Forum and academia, through member states, authorities, but also through the think tank, and through international organizations such as UNAIDS, WHO Europe. In terms of instruments for the implementation, there are several instruments, although unfortunately no specific instrument just for the action plan. So we have the Global Fund, which is a big question following the change of their strategic priorities on funding strategy. Then from Commission side, the European Neighbourhood Partnership Instrument, the Development Cooperation Instrument, the Public Health Program, and also the Research Program. We have surveillance, as mentioned before, and cooperation, again, through the think tank and the Civil Society Forum. Now, what are the next steps? And this relates to the date 2013, where the current framework is due to come to an end. We have the personal commitment of Commissioner Borg to keep HIV/AIDS high on the political agenda, particularly in relation to addressing stigma and discrimination. In May this year, the Commission, jointly with UNAIDS, has organized a high-level meeting on HIV/AIDS and human rights. The Commission also organized a workshop on improving access and combating discrimination in healthcare within the framework of the European Health Forum Gastein in October. And we are now planning another conference on access to healthcare with a particular focus on HIV/AIDS, which shall take place in March 2014. In addition, the Commissioner has decided to endorse the European HIV Testing Week, which will start on the 22nd of this month, so tomorrow actually, and will last for 1 week. And I think with your pack you have also received some information on the testing week. What else? As mentioned, the Commission communication is currently externally evaluated. It was started in September 2013. We expect the results to be available in spring 2014. And this will inform the development of a potentially new EU policy framework on HIV/AIDS, provided that a new policy framework will be needed. Secondly, it has been decided that the action plan is being updated. We are currently working on that in order to allow continuity between the expiration of the communication and the current action plan and the decision on a new EU policy framework. By updating the action plan, we are trying to address gaps and do some fine-tuning. There are issues included in the action plan which will need continued attention, such as the political leadership issue, but also, since the action plan was originally developed in 2009, there are new developments which need to be taken on board. We are discussing these issues with the Civil Society Forum, the think tank, WHO, UNAIDS, and Commission services and agencies. and also draw on the results of the high-level conference on HIV and human rights, on the ECDC monitoring report, monitoring of the implementation of the Dublin Declaration, UN/AIDS reports, etc. Perhaps just to give you some idea of the timing, we are this week actually completing our draft updated action plan. We plan to have it in intra-Sanco consultation next week, and then we need to consult with other Commission directorates, and the plan is to have this updated action plan formally approved before the end of this year. Thank you very much.